And we're back. Welcome back again to the HBN Radio Show. That's hbnradioshow.com, hbnradioshow.com. And again, we have our distinguished guest this week, Dr. Reed Gelzer. He's an expert on the area of EMR and compliance. So this involves the whole area of data integrity and making sure what you put in your EMR system is going to be a document that is accurate, that can be relied upon, because you never know if you're going to be in court sooner or later. You're going to have that document is a legal document, and if your EMR system lacks the data integrity, you might find yourself in big trouble. So I wanted to get into the next question, very important question here, Dr. Gelzer. Do you believe that hospitals and providers are moving too fast in purchasing EMRs, which will ultimately put their compliance programs at risk?
Well, that's a fascinating question if you think about it, especially from my point of view. I got into this because I'm a very strong EMR advocate. I got into the compliance side simply because I saw too many people implementing systems as if they were plug and play. And so, in a sense, I'd like to see people move faster, but they need to move much more thoughtfully. For example, I often get calls on situations where it's discovered rather late in an implementation that the hospital or the provider organization never tested the system to see if their own medical records policies and procedures could be carried out in the system. And in hospitals in particular, this has been a very vexing problem because, for example, a very common discovery is that depending on who generates the record output, the output looks different. And you can imagine, for example, if you're in a legal case, and this has happened, where there are 3 different outputs from the system, it's all the same information, but it looks different. And the judge is kind of wondering why one version looks different from another, which one is real. So simply testing the most basic functions of systems often has not been done as part of due diligence. So in that sense, to the extent that organizations are not bringing their health information management and compliance resources to the table when they evaluate systems, they are indeed moving too fast.
Why is the government so silent? You hear so much about the incentives, to get EMR systems. Why is the government so silent on the compliance issue in EMRs right now? You hear literally nothing. In government, you hear all the talk about fraud and recovery of monies for fraudulent billing, but you have heard very, very little from the government to say to providers, say to hospitals, look, we are encouraging use of EMR systems, but you need to be cognizant of the compliance issue. Why is the government being so quiet about this?
How many swear words can you bleep out in your broadcast?
As many as
Ron?
You like.
I think probably the most important thing is to realize that the government assumes that when people buy systems that they do appropriate due diligence. The other difficulty, of course, is that the government has made it a matter of national policy to push health information technology, and they've made the decision to do that in advance of robust EHR standards. And even basic EHR certification doesn't encompass basic compliance issues. For example, the retention of the original version of an amended record only became a certification test requirement in the 2011 CCHIT certification requirements, if you can imagine that. So in part, it's an assumption that people will do due diligence, and on the other hand, it's also a press to push forward with health information technology, and no one is saying do it fast and carefully. They're just saying do it fast.
In your opinion, who's going to end up being held responsible in the future for compliance breaches? It's going to be providers, hospitals, or even the vendors? Who in your estimation is going to end up being held responsible for this?
Well, the ultimate cost, of course, is going to fall to the patient in the sense that what happens when there are inaccurate records. Remember, compliance is basically about truthfulness, and what happens when people don't believe the records that they're looking at. So, unfortunately, and there have already been some cases to this point, but as far as the financial burden, it's going to fall on the providers and the hospitals. There's in the resource list that I've provided for you to distribute, Ron, there's an article from the Journal of American Medical Association referring to the hold harmless clauses that are in most EMR contracts. And I would encourage people to look at that because it does highlight where are the burdens going to fall.
Yeah, I just want to mention to our audience out there, thank you so much, Dr. Gelzer, that we will be putting up on hbnradioshow.com next to the area where you're listening to the streaming interview with Dr. Gelzer here. We're going to be putting up a EMR clinical due diligence and medical legal compliance resource list. This was done in January 2011, this month. And Dr. Gelzer kindly put this together for our listeners out there as a resource guide to get you started in the area of EMR purchase and being cognizant of the compliance issues, which really leads me into my final question, Dr. Gelzer. And you mentioned this before, but just to go back again, what do you think right now hospitals and providers need to do now to avoid compliance risks down the road?
The most important thing, Ron, is to simply remember that they're in the business of providing quality health care to their friends, their families, and their patients. And it seems perhaps trite, but I always find it helpful to remind people that this is an industry that we are all citizens of, if you will. And so in that sense, they need to be looking at these systems as tools, and they need to be looking at them as tools that are, in fact, works in progress. And the due diligence is of critical importance, and in so many, many cases, it's become a rather sad and depressing, recurring, almost universally recurring event that I hear that when a system is being evaluated, the information technology people are at the table, the clinicians are at the table, but there's no one from health information management, there's no one from compliance, there's no one from risk management. And so bringing those resources, those eyes and ears, and those perspectives to the table is absolutely critical.
That is a point well taken. Dr. Gelzer, I want to thank you so much for taking the time out to be on the HBN radio show this week. If we could just get your contact information, if anybody would like to contact Dr. Gelzer, what is your email address, Dr. Gelzer?
Sure. It's on the resource list. It's rdgelzer@docintegrity.com, and spelled just how it sounds. And I thank you, Ron, for this opportunity to convey this information to your listeners. It's a critical message, and I thank you and your organization for passing it along.
Well, thank you so much again, Dr. Gelzer. It was a real pleasure, again, having you as our guest this week on the HBN radio show. Again, I want to let our listeners know we will be back next week with another fascinating topic in the area of the business of healthcare. And I want to wish all of you out there well. Again, you can find our shows at hbnradioshow.com, hbnradioshow.com. And I want to wish all our listeners out there good luck, and may the good news be yours.